All right. Everybody can see that okay?
Yes.
Great. Well, good morning, everyone. Welcome to our webinar on ED Alerts, Connecting Montana Hospitals. My name is Ah-Young Huff, and I'm one of the outreach coordinators at Big Sky Care Connect, and I'll be your host for this session. And we really appreciate your attendance to learn more about our electronic solution to assist Montana hospitals with the pandemic. So if you have any questions throughout the session, please feel free to use the chat function. Kelly will be monitoring the chat for us. So we're going to just start out with a few words from Jean Branscombe, who is the acting CAO of Big Sky Care Connect.
Well, thank you, Ah-Young, and thank you so much for joining us today. We are simply excited about the advancements that have happened over just the last 6 months in the establishment of a health information exchange in Montana. And before I dive into that, I first would to just give each and every one of you a pat on the back and just really heartfelt thanks for the heroism that you show each and every day and your staff show each and every day for the work that's being done during this time of the pandemic. It has certainly been an unusual year, and the hospitals are in the midst of that, and just again, very much appreciate that work that you do. We have been working on the Health Information Exchange for a few years now, and actually just signed a technology vendor back in March and are looking to stand up the HIE by the end of the year. We have a technology solution that really is in place to help each and every one of you achieve the triple aim, and we're excited to do that. Of course, that's what we'd be talking about today if we didn't have a pandemic. And because of the pandemic, we really looked at what kind of technology that we could advance on behalf of patients in Montana that can be tools utilized in healthcare facilities to help you manage the pandemic. And we're so delighted to have a partner like Collective Medical that you'll hear from today that is going to connect the emergency departments across Montana. And of course, with this technology innovation that we're going to be showing you today, it comes at the bequest and the hard work of a board of representative healthcare stakeholders, and that includes hospital CEOs and of course the Montana Hospital Association. So it comes at no surprise that the Hospital Association came forward and said, this is a tool that hospitals could really utilize, the sooner the better. And again, we put all our kind of eggs in this basket of really helping you out during this pandemic. Working on this is a top priority as we continue to roll out the Health Information Exchange. So with that, thank you so much for joining. I think you're gonna be delighted with the information that you're seeing today. We're available to answer any questions that you have, and look forward to hearing those questions as the presentation proceeds.
Thank you, Jean. All right, so now I would like to share with you a message from Rich Rasmussen, Montana Hospital Association's President and CEO.
I want to thank all of you for joining us here on this annual meeting for Big Sky Care Connect. I'm going to spend just a couple moments talking to you about Collective Medical Technologies' ED optimization tool. Now, MHA was fortunate to have the opportunity to work with the federal government's Assistant Secretary for Public Response, or ASPR. Early on during the pandemic, MHA worked with ASPR on a project to send out a series of mini grants to our members. ASPR then came back to the state hospital associations and MHA and said, we have an opportunity, or providing an opportunity for you to do something additional, second mile for your members. And it needs to align with a certain set of federal guidance to bring hospitals together to allow for a project that would accelerate adoption or use of a vaccine and also allow for a greater collaboration between providers. And so as the association began to look at what those opportunities were that were out there in the marketplace, one of them that came to mind was clearly the ED optimization tool that Collective Medical Technologies has. Now, many of you might have heard the term EDI, Emergency Department Information Exchange, used in the past, and that is the tool with a new name. And so the optimization tool is designed to connect emergency departments all across the state of Montana. And if you look at our peer states around us, all of them are using the ED optimization tool. Now, what does that mean for us? It means it creates an opportunity for our hospitals to collaborate between emergency departments, allow those clinicians who are working in the EDs to be able to immediately examine a patient, but also look at where that patient may have been treated subsequently and what care plans are currently logged for that patient. Is that patient in need of any specific medications that might not be present upon admission or upon entering the emergency department? So essentially, anything that would happen within the scope of care delivered in an ED, our clinicians in Montana would have access to that. And it would allow them to be able to see where that patient has been. So, for example, if someone presents symptomatically for COVID-19, we would be able to immediately look and see where that patient may have been anywhere else in the last couple of weeks. That allows us to immediately be able to help with any contact tracing that takes place, but would also allow our hospitals to be able to learn more about the origins of where that person may have been. And then certainly if there's any other health conditions that may have been recorded at any point in the past for which they came to the emergency department. So there are ways in which we can utilize this tool, not only in COVID-19 and our response today, but also in other use cases that can help us to improve care delivery in our state. Let's give you an example of one, doctor shopping. We know that Montana is a state that struggles with opioid addictions. So the ability to be able to track a patient when they come into an emergency department and to immediately see whether or not that same patient was seeking a prescription, say in Oregon or Washington or Idaho, all surrounding states that use the ED optimization tool. If we're also trying to identify those frequent flyers that come through our EDs so that we can do a better job of managing that patient's care and reduce cost, that is also a use case that can be used. Perhaps if we're trying to address issues related to human trafficking, the tool also has the ability for us to be able to potentially use it to address those issues as well. So there are a number of utilizations for the ED optimization. And so we believe that our hospitals will have the opportunity to use this not only in responding to COVID-19 today, to share what's going on in our emergency departments, to accelerate the use and deployment of vaccines and to share information with our state labs, but also other use cases that can help us to improve healthcare in Montana. So we're delighted to be part of this effort to improve access to cutting edge technologies that will allow us to align with our peer states and will also empower us with tools that can improve healthcare, can improve our outcomes, and improve the quality of care that's delivered in Montana. So that's what we're doing right now with the ED optimization tool, and we hope each of you will take the opportunity to learn more and to sign up. MHA has worked with ASPR to pay the first 2 years of subscription fees related to it. So there's no cost for hospitals to use the ED optimization tool. And so with that, we hope that you will use this as an opportunity to onboard your emergency department and use it as a tool so that you can collaborate with your facilities all across the state of Montana. This is something that is being used, as I mentioned, in a number of other states. And certainly as we see in the Mountain West with the growth of COVID-19, and the large number of patients that migrate to Montana during these holiday seasons, having this beginning in this fall and certainly throughout the ski season in the spring and then into our summer season here, it will allow us to be able to also track patient activities in their home states when they come to Montana. So we believe it's a very effective tool and we encourage each of you to use it. And we appreciate the opportunity to spend this moment with you today talking about our involvement in helping to bring the ED optimization tool from Collective Medical Technologies to our providers in Montana.
Great. Now we will hear from MHA's Foundation Executive Director, Victoria, about the ASPR grant.
Hello, my name is Victoria Seck, and I'm the Executive Director of the Foundation here at the Montana Hospital Association. And I just wanted to provide a little bit of background about the ASPR Grant Assistant Secretary for Preparedness and Response. As I think Rich has mentioned, this was an opportunity that was made available through ASPR to hospital associations throughout the country to help with response to the COVID pandemic. The strategy that we chose to apply for, which is this emergency department optimization option through CMT, is something that, as Rich has mentioned, has other uses in addition to COVID response. But the nice thing about this is that it will help you manage the response to COVID better, and it will also link emergency departments with the state's lab and with their MTRACS program to help track immunizations. So we're excited about that, and we hope that will prove very useful. We have sufficient funding to offer 2 years of subscription to each of you for free. And in addition to that, Sean Becker with MHA Ventures is going to be working to help people get up and going with this and provide some support and some logistics as the project rolls out. He can talk a little bit more clearly about Big Sky Care Connect and their role in helping make this a reality throughout hospital EDs in Montana. I hope you'll be very interested in taking advantage of this. I hope you'll find it an extraordinarily useful and helpful way, both to manage the pandemic and to manage other continuing threats subsequent to the pandemic.
Great.
Thank you.
So now I will turn the time over to Sean Becker from MHA.
Good morning, everybody. Bert, that background of yours, the plastic, it's like they put you in the basement.
So my office is the is the respiratory ER in case anything happens. So if we have a ER come in with respiratory issues that we don't know if COVID's involved, I grab my laptop, run out, and they wheel them into here.
Yeah, there's a critical access hospital CEO example right there. You're in the respiratory unit, your office.
Yep.
Hey, so I don't have much more to go beyond what Rich and Victoria had to say. Just to point out that there are 2 aims for this meeting this morning. One is to get you excited about the ASPR funded solution, and the other is to really kind of answer any questions, concerns that you may have as we go through the overview of implementation. And so we really need a plan from every hospital in the state by the end of the year, was the goal, on how we are going to ramp this up in your facilities. So thank you for joining us this morning, and looking forward to all of your questions. I'll turn it over to you, Ayang.
Thank you, Sean. Well, for those of you who aren't familiar with Big Sky Care Connect, I got a just overview of Big Sky and our platform. So we were established back in 2018 as a nonprofit organization to establish and operate Montana's statewide HIE, and endorsed by Governor Bullock. So Big Sky Care Connect has the infrastructure and the partnership with Collective Medical already in place to support this statewide preparedness effort. So we have already established the necessary participation and data sharing framework in Montana, and we can assist in amplifying the data exchange and contributing information to better inform decisions at the point of care. So there's a lot of evidence out there on the benefits of statewide HIE participation, and more data is being shared to quantify some of those value propositions. So the hospitals that have been participating in their state or regional HIEs have already realized better outcomes with reductions in readmission rates, decrease in duplicative services, increase in revenue from better documentation, cost savings from avoiding adverse events, just to name a few. But as Jean mentioned, our ultimate goal is to help hospitals in Montana achieve the quadruple aim in improving outcomes, improving clinician and patient experience, and lowering costs. So we partner with InterSystems, who is our vendor for the HIE platform, and we're currently underway in standing up the statewide HIE. So we built the foundation with integration tools and privacy and security measures, and we're currently working on bringing in the data from participating healthcare organizations to build a robust, comprehensive patient record. So along with the comprehensive patient record, we'll also be providing medication history with data from Doctor First. And if you don't have direct secure messaging, we can provide that as well. And patient event notifications, and that will all be part of our core services. So the event notification can actually help you meet the new requirements from CMS that will be coming to you in the spring of 2021, where they'll require hospitals to electronically share ADT notifications with their patients' primary care providers. So if you don't have something in place for that already, this could be a quick return on investment for you. So statewide HIEs have really demonstrated their value during the COVID-19 pandemic by providing a platform where vital patient information and hospital status can be shared in real time efficiently and cost effectively. So Big Sky Care Connect quickly responded to help address the pandemic in Montana by partnering with Collective Medical to provide a value-added service of our ED Alerts platform, which is the focus of our webinar today. So Big Sky Care Connect is also working with the Montana State to help providers gain easier access to the public health data, including COVID-19 test results. So once we get connected in the future, COVID-19 results could be available to you in the provider portal in Big Sky platform, as well as through our ED Alerts notification system. So we chose to partner with Collective Medical because of their proven track record. Their ED optimization has shown to reduce high utilizer encounters by 81%, 30-day readmissions by 78%, retention rate of 63% for those enrolled in medication-assisted treatment programs, and 50% reduction in violent incidents. So BSCC's ED Alerts will feature a bidirectional EHR integration with Collective Medical that receives real-time ADT and continuity of care information from all of our connected entities across the state, as well as Collective Medical's already existing extensive network. Additionally, HIE automatically pushes the alerts and the curated care information directly into the existing hospital ED's workflow, allowing the care team members to immediate insight into properly care for the patients. So without further ado, I will introduce you to Brian Cawley at this time. He is the Enterprise Sales Executive at Collective Medical, and he's going to show us what this is all about and how the system works.
Thank you, Ayung. Good morning, everybody. Appreciate you all being here. I know it's is still a little bit dark and early, but here we are. So thank you for your participation. We will just go ahead and jump right into it. And Ayung, can you just confirm that you're able to see my screen if you would, please?
Yes, we can.
Thank you. So just as a quick overview of the agenda, we'll talk a little bit about who Collective Medical is. We'll go through an overview of the ED Alerts and what that means for your hospital, and then we'll actually jump into an example portal to show you what that looks like and what that feels like for your providers on the back end as users. Collective Medical is the nation's leading care coordination platform. We connect all points of care to provide visibility into at-risk and high-risk patients at the point of care. We are 100% focused on real-time collaboration, not simply to move data from point A to point B, but derive meaningful and valuable insights to support and encourage more informed clinical decisions on those high-risk patients as they transition through the healthcare continuum. What that means for your providers is receiving real-time notifications with the most relevant and important information on these patients, leading to improved quality and outcomes, reduced cost through performance metrics like Ayung talked about, reduce readmissions and overutilization, increase throughput, and reduce unnecessary workups, better management of behavioral health and substance use patients, et cetera, et cetera. We are actually live in 42 states across the country. We do have identifiable patient information across all 50 states. That is due to our partnerships with not only hospitals and health systems, but ACOs. We partner with every major health plan in the nation. We also partner with post-acute providers, ambulatory providers, as well as Commonwealth and Care Quality. So we have a very in-depth, robust network where we actually receive this data from. We are live with north of 1,000 hospitals and more than 3,100 partners overall. Ayung showed a similar screenshot to this on the right, but just to kind of reiterate, your hospital's ADT is transmitted to Big Sky Care Connect Big Sky Care Connect and Collective Medical have a bidirectional feed. We then aggregate and curate that data from them and send that back to you into those notifications via an HL7 message directly into your track board. When we think about the asymmetry of health data and the ubiquity of healthcare information, it's extremely difficult to truly understand a longitudinal history of your patients as they present. Now, to be clear, we're not talking about every patient that presents to your facility. Really, we're focusing on those 10, 12, 15% of patients that carry risk with them. Conversely, when you think about providers who have a mutual treatment relationship with these patients, it's often difficult or unaware for them to actually coordinate with other providers, leading to, again, unnecessary workups and inappropriate interventions, et cetera, et cetera. If we think about the traditional healthcare system and how that might look for a patient as their journey continues through, this is just an example, but a patient presents to a hospital with a CHS exacerbation with shortness of breath. They might be admitted to the hospital. A few days later, they may get discharged to a skilled nursing facility, and from there, they may get discharged home. Now, that patient may have an exacerbation a couple of days later. They call 911. The ambulance routes them to a different hospital that's on a different system. So ultimately, this new hospital has no idea that they had all of these other encounters previously. They may end up doing similar workups. The patient may end up getting admitted. They may end up getting discharged to home or self-care again. And so this cycle continues. With Collective, we'll just fast forward to that secondary ED encounter, as opposed to this hospital continuing to do those workups and potentially admitting this patient again. They now receive that real-time notification that tells them this patient was seen at this ED, they were admitted at this facility, they were had a stay at this skilled nursing facility. Here's potentially some recommendations on what we have for care. So the coordination is then very easy for them to communicate with that hospital and potentially other providers. And they may have a completely different workup that enables them to avoid that readmission. They might be able to safely treat that patient and discharge them to home or self-care. You are now able to intervene on these cyclical hospital utilization patterns and provide better quality and better outcomes for these patients. In bucket one, we talked about the sources where we get our data from different provider sources across the country. So we'll just kind of pass through that. In terms of data aggregation in the second bucket, we curate and aggregate these enormous and robust data sources to be able to provide you with that actionable information at the point of care, which puts us into the third bucket. We have a comprehensive patient matching algorithm in addition to deterministic risk and deep learning models that enable us to curate that data for your providers, putting us into the fourth bucket, being able to deliver those notifications directly back to your providers in real time, in addition to providing reports to really benchmark how you are managing some of those high-risk populations in a stratified view. How this all works: your patient presents to the ED, they check in as they normally would. That information is then sent back to Collective Medical, where we then query our database to find out what information we may have on this patient and what is relevant to your hospital in terms of, do we need to send a notification back to your providers? If so, we will then send that HL7 message directly into your track board, where an icon can be clicked and that notification can then be viewed. We've talked about the real-time delivery into your track board. There are other modalities that we can deliver those notifications as well. Say, for example, if you have providers that don't necessarily operate directly out of the ED, that could be case managers, social workers, et cetera, we have the ability to send notifications to them via text message, email, fax, printer, really whatever means necessary for them to be able to stay involved. We will certainly work to accommodate that. And then lastly, the ability to actually log into the collective platform and view a more in-depth view of that patient themselves. Just a few screenshots to kind of give you an idea of what this interface or integration looks like into your EMRs. So you can see here, here is a screenshot of Cerner specifically. Epic, you can see on the left side, there's the EDI column like Rich had talked about, where it would show the icon if a notification is available for that patient. And then just a quick one for Meditech as well. So when we talk about these notifications, what does that actually mean? So we have built out a set of best practices where our hospitals have kind of given us a benchmark on what is some of that important data that we need to know about these patients. So high utilization patterns. This could be something like 5 ED visits in a span of 12 months. Could be traveling patients. Has this patient visited 3 EDs in the past 90 days? If they have any care guidelines written on them, you will receive a notification. Any past history of sepsis, any past safety and security event. Now, this could be not just physical or verbal, but non-physical as well, i.e. Has the patient left AMA with an IV still in place? Have they had any sort of property destruction, anything like that? So pretty broad range of events that fall under that category. And then lastly, and certainly not least, any past positive COVID-19 lab result. So when we talk about COVID, that's certainly a huge highlight right now. And I know it's been a big conversation focal point of these webinars specifically, but really Collective built out a functionality to enable hospitals to identify, track, trace, and treat COVID-19 patients more effectively. And just to give you an idea of the prevalence of these patients actually moving across not only the nation, but just the healthcare continuum in general, this is a screenshot of Collective Medical's network and all of the patients that have transitioned from one hospital to another that have had a positive COVID-19 lab result. So you can see pretty significant, and hopefully this helps kind of understand the importance of receiving that information the moment that patient presents to your facility. And just we'll go over this in a little bit more detail when I show you the actual portal, but this is what you would see on that notification. You can see under the care insights, it shows right there at the top, this patient had a positive lab result on this date. And then this is what it would look like if somebody were to actually log into the collective portal. It would be right there at the top under the patient demographics, identifying them as having a positive lab result. Now, I don't show you this slide necessarily to highlight Collective Medical's network growth. Rather, going back to what Rich had talked about earlier, doctor shopping, high utilization, traveling patients, high popular places for seasonal travel. And you can see in 2019, really the extensiveness of patients moving across the healthcare landscape, and really just how important it is to understand not just the patient sitting in front of you, but ultimately what they've been treated for in other counties, other states, other facilities. Lastly, we'll just talk quickly about what the implementation process looks like. Pretty straightforward on our end from Collective Medical. We just need to establish a secure VPN. We would then build out the return notifications to your EMR, establish single sign-on, and then request a historical patient file so that we can ingest that, and you are then seeing value from day one. So with that, I'll go ahead and jump right into the portal itself. Young, can you confirm that you're seeing Ruby Valley? Cool. So this is obviously just an example EMR track board, but to give you hopefully a better concept of what this looks like for an end user. If I'm a provider looking at my ED track board, have all the same standard information, right? Patient's name, their chief complaint, and then a number of icons typically populating here. Does that patient need labs? Do they need imaging? Do they need an EKG, et cetera, et cetera? In this EMR example, you can see that we built out an icon, just a 8x11 piece of printer paper, which indicates that that is the ED notification. So if I'm a provider and I see this populate on a patient, now, again, this is in real time. So this would populate before your provider even sees this patient. So I'm able to click that icon. I would simply, a PDF would open, and it's this one-page document, and we'll kind of go through this here. At the top, you will see immediately why that notification was triggered. You can see here that this notification for Bill Tyler triggered because he has a care guideline written. Below that, you will see any past safety and security events that we talked about, a brief synopsis of what happened, what type of event it was, and then an aggregated total over the last 18 months. Next, you would see care recommendations. These are typically 3 to 5 bullet points of the most pertinent, relevant information to help those providers make better decisions for those patients, or at least understand maybe how they need to approach that workup. This is also synonymous with the care guideline. The care history will show you past medical and surgical history, as well as behavioral health, social determinants, et cetera, et cetera. Recent visit summary will show you all visits over the past 12 months. I apologize, that says 6, but over the past 12 months for any inpatient, observation, or skilled nursing facility visit. It would show you the admit date, the facility, what type, the diagnosis, and what the discharge disposition was. And it will also show you the emergency department visits below that as well. Similarly, what facility it was, what the diagnosis, disposition as well. And then we will see a quantitative view of all ED visits over the past 12 months. It will show you the hospital, the visit count, and then the total quantitative number there. We are going to skip past the PDMP section right now. This is something that we are actively working on in Montana. It is not approved and stood up yet, but in the works. You will lastly see a list of providers that are part of that patient's care team. You will see the provider's name, their specialty, and their contact information. And then just to mention on a last note here, if the patient has had any specific documents uploaded into the collective platform, whether that is advanced directives, pulsed orders, pain contracts, et cetera, it would mention that those are available for you to view in the portal down here. And just to kind of continue on with the care guidelines section, we'll just show you a couple of example patients that we put in here. So if you look at this patient, you can see that they have DNR, DNI, adenocarcinoma, history of CHF. They have poor home diabetic control, present with DKA. Recommendation, if they're altered mental status, right away do blood glucose before any other intervention. So you can see just very succinct and very concise on some of those recommendations to potentially approach this patient's care. Alternately, you can see Sally Croxton has a history of behavioral health, substance use disorder. She's currently on a buprenorphine treatment, has a history of schizophrenia, anxiety, takes valproic acid. So you can see that the guidelines really are targeted for that patient to be able to determine what's the most appropriate action for me to take. With that, Young, I think we've gone through it, and I'll turn it back to you.
All right. Well, does anybody have any questions for Brian at this time? We can talk a little bit about the platform and any questions you may have at this time. Oh,
So-
we do. have a
Brian,
question?
hey, it's Sean. So there are 2 counties in Montana that are the top 10 busiest in terms of new cases per capita every day in the United States out of 3,224 counties. Number 2 in the United States is Prairie County, and number 6 is Powell County, coming in at 4 cases a day and 3 cases a day per 1,000 population. Projection lines are not great. Obviously there's some concentration of infection going on in the counties, but we're fortunate position today. We have both counties in the critical access hospitals on the call today. If there is a plan B here, that if a facility would like to stand up this service very quickly using a fax machine, could you talk about that? And so if we wanted a rapid implementation, what that would look like?
Yeah, absolutely. I appreciate you bringing that up, Sean. So we definitely focused very specifically on integrating directly into an EMR track board. Now, there are unequivocally circumstances where it may just not make sense for a hospital. We see this a lot in critical access where maybe they don't operate primarily out of an EMR system, and it might make more sense to receive a fax or a printer. So with that being said, we absolutely have the ability to send those notifications via fax or printer. And if you're talking about timeline and implementation, doing it that method versus an EMR interface is significantly shorter. We're talking somewhere between being able to stand this up and have notifications being sent to you in a week or 2.
I do have a question from Deer Lodge Medical. How do you prevent misinformation from being provided to a facility when there might be a registration error? For example, John F. Doe presented but was registered as John C. Doe.
Yep, very reasonable question. So it goes back to, and I probably just kind of skimmed over it, but our data matching, patient matching algorithms are extremely comprehensive and don't just focus on one component of a demographic or a patient's name. So if we have a John C. Doe register at Deer Lodge, we will match and benchmark that in our database, not just based on a name, but can we match other providers? Can we match birth date? Can we match Social Security? Can we match a whole number of other pieces of information versus just looking at that patient's name? Certainly it goes far more in depth than what I'm explaining now. Now, there are circumstances where we may not be able to accurately and 100% confidently be able to match that patient specifically. Take, for example, if a patient shows up to your facility, maybe they're unconscious and don't have an ID or whatever the case may be. If we absolutely have to, we will create a new patient in our database. As you obtain more information on that patient, whether that's through family or law enforcement or whatever the case may be, then we can start to connect the dots and be able to reconfigure or merge those 2 contacts. So now that we know those are the same 2 patients. So hopefully that helps provide some context, but again, our matching algorithm goes well beyond just looking specifically at a patient name.
Great. We have another question from Brad. How does security info and alerts get uploaded and entered?
So specifically, it sounds like that's safety and security events. So primarily the way that it's uploaded into the collective network and the collective platform is having your providers, whether that's a nurse or an ED physician, and a PA, NP, whoever that may be, can log into the platform. It is extraordinarily easy to log safety and security events, and I'm happy to show that if that's helpful for anybody. But ultimately, it takes just a couple of minutes. They upload that information in there, and again, it's populated for 18 months at any subsequent visits that patient has.
Great. The next question, is it only accessible by a provider or would the charge nurse be able to have access? I could take that one, Bryant, since your use of the product will be through Big Sky Care Connect. So for Big Sky Care Connect, your fee schedule is paid upon the number of providers, but anyone in your facility, including nurses, front office people, can have access to the system. And whoever has access to the Big Sky Care Connect HIE would have the same access for the ED alerts. And the next question, let's see, our EMR is hosted by Providence Epic. Have you already integrated with that platform in Montana? I don't know that we have. Others can chime in. We have a technical team that deals with all the onboarding. I don't think other outreach coordinators can chime in. Have we done Epic yet? Not to my knowledge.
Young Paul. We've had discussions with Providence, and we're working with their technical team, both locally and regionally. But we haven't completed that work, but it certainly is on our roadmap.
Yeah, and it's definitely doable. Intersystem and Collective Medical are very capable of integrating with Epic. That should not be a problem, right, Bryant?
Yeah.
No, I'll actually just add to what you all were talking about, and folks from Big Sky know this already, but Providence Hospital, specifically St. Pat's and
St.
Joseph's, thank you, have been longtime partners of Collective Medical, and yes, we are already integrated with their facilities.
Yeah,
yes.
and they use the Collective technology across their organization, across all of Providence. So it's not a matter of if, it's more a matter of when.
Yeah. Okay, we still have some more questions here. Are we protected when it comes to sharing information from hospital to hospital or state to state?
Yeah, definitely. We follow all HIPAA standards. We are high trust certified, and do not disclose or share information outside of any TPO relationship. So data will not be transmitted just arbitrarily. If you get a little bit more granular and specifically talk about some of the sensitive information, 42 CFR Part 2, et cetera, we do have, as well as Big Sky, very, very comprehensive structures in terms of opting in, opting out, so on and so forth.
Yeah, and like Brian mentioned, yeah, it's in transit and at rest. So data, it's very secure. And we have different roles for different people. So only certain people that are designated by your facility will be able to break the glass or have access to the sensitive information. And we'll have a different role for access for people at the front desk, for example, or a privacy officer or a clinician. So that will all be handled through the onboarding process. Okay, the next question, how long is implementation and testing? Have you had any integrations with Meditech 615 or Expanse?
So if we talk just strictly about historical timelines on the time frame to get this from start to finish, usually what we see is somewhere between 8 to 12 weeks, depending on how quickly the hospital can and wants to move. Do they have IT resources available? Is everybody on board and it's full throttle? So there's a little bit of fluctuation there, but typically we like to say about 12 weeks. Now, we'll talk about Meditech, 6.15 and Expanse. So we have integrated with Meditech before. However, we are currently working with them to build out native integrations for all hospitals that operate under Meditech. So everything previously we've done up to this point has been all custom built. Now we are working on building out these native integrations. That is in the process. We anticipate that by Q1 of 2021, we should be either there or very close to being done. So the answer to that is that yes, Meditech integration is absolutely available and in the works. Now, if we say we'd really like to just get this going right now so that we have those notifications available, again, we can do the printer or fax to your ED. Now, that takes the 12-week implementation time frame down to about 4. So it takes a pretty significant amount of time off of doing the EMR integration. Now, you may ask, okay, well, if we do print or fax, does that alleviate or eliminate the option to do an EMR integration? The answer is no. We can stand up printer or fax and then go back and do the EMR integration at a later date.
Just to elaborate on what Brian already said, so he's talking about timeline for the collective medicals ED alerts. There is a little bit of pre-work on that. You do have to establish ADT with Big Sky Care Connect first. So you'll set up a VPN, and then we'll start the integration process for ADT. And once that's established, then we would move on to the collective medical integration. So just so.
Sorry, I may have put the cart before the horse there.
That's okay. I just want to make sure that everybody understands that step. Another question, I am assuming that the care plan information, et cetera, is manually uploaded into the platform as well by someone at the facility, similar to the security event?
That's correct. I don't want to get too far into the weeds with this, but we are rolling out Smart on Fire app to be able to have this an automated process where information from your EMR is actually uploaded into the collective platform. But let's not, I don't want to get too focused on that. That's certainly a conversation we can maybe have one-off if hospitals are interested. But the answer is yes, the care guidelines are uploaded manually. Again, typically these care managers or social workers have something either already in place or are very easily able to put together some of these care plans, copy and paste whatever works best for you. Again, it's a very, very quick and user-friendly process to get those uploaded. And then of course it's available not only to your hospital and providers, but anybody on the collective network now has access to that care guideline as well.
Yeah, and I'll just put in a plug. St. Patrick, who has been using collective medical for the past couple of years, we actually did a webinar and featured them because they told us about how valuable this has been for them. And they have actually found this platform to be useful for care coordination with the FQHCs in their community. So they have a grant right now where they gave access to all of the medical clinics and primary care facilities in their community, and they're actually using it as a care coordination platform. So I just wanted you guys to be aware of that there are other uses for this platform that goes beyond some of the things that we're talking about today, okay? The last question we have is, can you provide a rundown of the cost after the 2-year subscription? An email after the call is fine as well. No, that's great. So I might actually start sharing some slides with you guys to answer that about the next steps. So let me do that. Okay, can everybody see my slide?
Yes.
Okay, great. So just to talk about the next steps, and then we can go into some of the cost information. If you haven't already connected to Big Sky, what you would need to do is sign the participation agreement and the BAA with us. And then in addition to that, there's a collective medical sublicense agreement if you want to take advantage of the ED alerts. You will have an outreach coordinator assigned to you to take you through all of these steps. So rest assured that you will have assistance through all of this process. But once the participation agreement and the BAA and the collective medical sublicense is signed, the outreach coordinator will work with you to complete an intake assessment. And this provides us with some general information about your facility, the key contacts, your training preference, your connectivity goals. And that information is shared with our technical team. And you'll be introduced to our technical onboarding analyst. And the analyst will coordinate a discovery call with you and your EHR vendor and the intersystem rep to kind of scope out the project. And then we'll establish a connection, most likely a VPN, and then we'll start working on the AD to interface. And once that gets started, then we can turn it over to the collective medical team for the interface implementation, and you can go live with that even before you go live with the Big Sky Care Connect. So as I mentioned, the Big Sky Care Connect and MHA Collaborative will be offering no cost for the service for the first 2 years. And after that, the hospital will be responsible for a subscription fee, as this feature will be an added service. There's a minimum charge established for maintaining the service for $575 per year, based on an annual volume of 832 ED visits or less. Now, if you have more than those 833 visits per year, it's an additional 69 cents per visit over that. So pretty minimal. I think Big Sky is taking the main fee and only having you pay for a portion of that. Hopefully that answered your question. Okay, and then as far as Big Sky Care Connect, I can actually show you the fee structure for that as well. So for those of you who are not part of Big Sky Care Connect yet, we have a share funding plan that is split between the state of Montana, the payer community, and the provider community. And obviously for the provider community, that will be supported through annual subscription fees. And their good news is that right now we will not be charging you for the subscription fee until January of 2022. So you will literally get over a year of risk-free trial of our system. And included in all of that is the onboarding service. After that, it is based on a fee schedule based on the tier levels. So this is the tier that we have set up. It's based on your net patient revenue. And so it'll be based on the tier plus $144 per provider per year. And the outreach coordinator can send you all of this information in an email as well. We'll definitely follow up with every attendee here through the email and answer any of your questions. But another good news is we do have an interoperability net assistance program available right now for a limited time. So any of the integration costs that you may have with your EHR vendor will be eligible for you to apply for this funding to pay for up to $50,000 for the cost involved in doing the integration. So it's a great time for you to join us at this time. And that does run out by mid of next year. So definitely benefit to signing on now rather than later. All right, any other questions? I gotta go back to the chat here.
Thank you, Bryant, Paul, Ayang, for all the information. And most of all, thank you, the hospital community, for the great questions today. This was a valuable session. Hopefully it was valuable use of your time as well. There are some other pieces to this that are being worked on. It was mentioned that we're connecting to the state lab on getting the COVID positive history for patients. We're also preparing for Project Warp Speed on the immunization event. And this is part of that package of tools that will be utilized. It will connect to the state MTRAX database, so find out whether or not somebody has been immunized. As well as there are other patient coordination, treatment planning, and pre-authorization advantages that we didn't really get into today. But all in all is a significant service. So our hope is that, as I mentioned at the beginning, that from this call that we're able to launch into a plan of what this would look like for your facility. If there are additional levels of approval that need to be made, we'd be happy to participate in those discussions. But per the Assistant Secretary of Preparedness and Response, our objective is to have a plan at the beginning of the year for every hospital in the state on how this could be implemented and when, and get things rolling.
All right. Thank you, Sean, and thank you, Bryant. Do you guys have any other questions? Feel free to unmute and speak up. I don't see anything in the chat.
Thank you.
Thank you so much. All right, I guess we can conclude at this time.